Andy Johnson. We are looking at a reading intervention, a comprehensive reading intervention. Doesn't just focus on phonics, it focuses on exactly what the student is having problems with. This can be used with RTI or others. Now remember, readers have 3 deficit areas, 1, 2, or 3. It's either comprehension, word identification, or fluency, or all of those. We do a diagnostic and we create our intervention based on the data we find in that diagnostic. Now, this particular intervention can be done individually or in small group. It's good for RTI 1, 2, or 3, and with anything. Adopt and adapt. Remember, one size of instruction does not fit all. You have to find the strategies that work for your student or students. Any strategy or intervention starts with a language experience approach. Here, the student describes an experience. Tell me what you did over the weekend. And the teacher records either on a screen or on a piece of paper or poster where they can all see it. 5 to 8 sentences. I say a minimum of 5 sentences. This enables the teacher begin to make some personal connections. It can be done individually or in small group. And it provides a meaningful context for students to practice their reading and to practice phonics and grammar. Once you have your paragraph, 5 to 8 sentences, you reread it until fluency is achieved. So they're practicing reading again using words and concepts with which they are familiar. You use this for the phonics mini lesson or grammar lesson. For example, in sentence 1, there is a word that begins with the l sound. Which word is that? Looked, leaves, good. There is a word in the second sentence that begins with the r or the d sound. What is that? Read. Good, good, good. In the first sentence, there is a suffix that tells me we did it yesterday. Today I looked. Yesterday I... All right, that's an example of how you do it. Very simple, very incidental in the context of real reading. And again, if word identification is a diagnosed area of concern, this is what you do. Comprehensive reading intervention is based on the 30 most common phonograms or word families. This invites the student to see word parts instead of individual letters. It is more efficient to see word parts instead of individual letters. However, this does reinforce vowels as well as letter patterns when you focus on these word families or phonograms. Let me give you an example. Here are 6 strategies. We're going to look at each one of those real quick. You want to spend 3 to 6 minutes on each one of these activities so that the total intervention should be 30 to 50 minutes. Remember, we're not teaching, we're developing the ability to recognize words and to create meaning with print. We don't teach reading, we create or we help students develop the ability. The first one, riddle review. We look at yesterday's phonogram. We need to see things. Again, planned redundancy. Here's a list of the OT family we're reinforcing. Not cold. Which one of these means not cold? And they have to look at the group and find the one that, all right? Very simple, not too complicated. We're reinforcing. It's kind of fun. It's a riddle. Onset-rhyme. When you introduce a new phonogram, the ing family. D plus ing is good. And they began to see the parts. Notice how the color is highlighted. K plus ing is. W plus ing is. P plus ing is. And so on and so forth. Word with distractor. And again, we're reinforcing the ing phonogram. Which one has the ing? Ding, good. King, good. And they have to differentiate. We're trying to develop those neural pathways so they recognize the ing family. Developing neural pathways, automaticity, they can begin to recognize word families. All right, the fourth one, the secret word. Based on the new phonogram, what is the secret word? And so forth. and you keep giving them clues until they can guess the secret word. All right, not too complicated. Close. This reinforces the phonogram and helps to develop the semantic cueing system at the same time. What does a king wear? So they have to see what word makes sense. I have the word king there in the sentence. I'm reinforcing that. And again, do you like to swim? This time the close does contain the target ing word. Maze, same thing. Ing. Do you want to blank with me? Which one makes sense? I'm reinforcing the ing as well as helping to develop the semantic cueing system. So they use context to identify these words. And then they see the word. Please don't fling the blank at me. Only one of those makes sense. Very good. Also, replay analysis. Student reads 3 to 6 sentences on the PowerPoint into an audio recorder. There they are. I like to sing a song. I hear the telephone ring. Notice that each sentence contains an ing word. We're reinforcing that. Okay. So they reread these into a recorder of some sort. The student listens to the recording and underlines any miscues, reads it again until there are no miscues. Review, read aloud, and record, and repeat until fluency is achieved with no miscues. Replay analysis. And the last one, sentence dictation. Either a teacher or a study buddy reads a sentence to the student writes the sentence. For example, I can ring the bell. I will bring the book. What color is your ring? All right? After each sentence, the student looks for words that do not look like, all right? So, words that are misspelled. What word doesn't look right? The teacher crosses out the word and writes the correct spelling on top. The student writes the correct spelling on the bottom. And if you are using a computer, you teach the student how to use spell check. And then when they finish, they go back and they reread the sentences until fluency is achieved. They see the words in the context of real sentences. They can use semantic and syntactic cueing, and we're reinforcing the ing phonogram. All right, that is it.